Coronavirus cases are holding steady in Virginia for the most part. Today, the health department reported more than 3,000 new infections. That's about 400 higher than the current 7-day moving average. 814 people across the Commonwealth are in the hospital with COVID right now. That's up 30 patients in the last 24 hours. Well, we could be entering a new phase of this pandemic. The CDC loosened COVID-19 guidelines today, changing recommendations for people who have been exposed to COVID-19. And that's not all. Angelique Arentalk breaks down the changes for us.
Our chances of severe illness have dropped considerably.
That's because of the tools available to Americans when it comes to COVID-19 prevention and protection. On Thursday, the CDC announced a relaxation of some guidelines. Regardless of vaccination status, quarantine is no longer recommended for someone who has been exposed to COVID-19. Instead, they're asked to cover up with a high-quality face mask for 10 days and test on day 5.
So if you've been exposed to COVID, we should really have you mask in all of the indoor spaces that you're around other people. And then, just like we do with all other infections, if you're sick, fever, cough, sore throat, nausea, vomiting, diarrhea, you should go home and you should get tested.
And after more than 2 years of stressing 6 feet of social distancing, the CDC is de-emphasizing the practice. Some residents are relieved, others are concerned. Hampton parent Renisha Williams says her rising kindergartner will opt to stay masked up in the classroom and follow social distancing as much as possible.
And still encourage him about being healthy and making the right moves, washing his hands, making sure he has his own sanitizer still. The same things that we did last year, making sure we still implement those.
But the biggie is make sure you're up to date.
Vaccines and boosters are still highly urged by medical experts, especially as the virus mutates. Angelique Arentalk, 13 News Now.
It's important to note the CDC says the recommendation to drop quarantine after COVID-19 exposure does not include people in high-risk settings like nursing homes and jails.